In school, there are different classes so that teachers can treat groups of students depending on their common needs. In motorsports, there are different classes to keep the game fair and safe. Because imagine driving your go-kart between Formula One cars. And in the MDR, we classify medical devices based on the risk connected to their use. So depending on what risk class a device is, we can apply suitable rules to keep the device safe. This is our medical devices classification pyramid. At the bottom, you see the lowest risk medical devices like wheelchairs, thermometers of various kinds, and hearing aids. At the top of the pyramid are the highest risk medical devices like bone implants and implanted pacemakers that keep a bad heart going. Depending on how much risk is connected to a device, we classify it as class 1 for the lowest until class 3 for the highest risk devices. But how do we determine the risk connected to a device? Well, there are many factors that play a role in that. For example, the level of invasiveness and kind of tissue being in contact with the device plays a role. Less can go wrong when a device will only touch your skin than when it must go through the skin and into the sterile areas of a body. But also the duration of the contact is very relevant. Surgical gloves will be on your hand for a brief time, maybe a few hours at most, but a new knee will hopefully be in the patient for many years. And there are many other factors that determine in what class a medical device belongs. Should the device be sterile? Will it be disposable or reusable? Because in the latter case, it must also be cleanable. Does it measure something important or perform some energetic action? Is it meant for diagnosis or also for treatment? And will it be used in combination with some kind of substance or other device? If there are several of these rules that apply, it's always the strictest rule, leading to the highest risk classification, that counts. In order to classify your device correctly, you will have to follow the rules set out in the MDR for that. You can find these rules in MDR Annex 8, and because not all of these rules are truly self-explanatory, there's also an MDR guidance document, MDCG 2021-24 on the European Union website. That explains these rules a bit more and provides nice flowcharts and examples for classifying medical devices. Now go ahead and check those two documents so we can start classifying some medical devices.